Thank you, everyone, for joining us today. Sorry about some of the technical difficulty to start things in the chat. But as you're coming in, if you can, just put in your name, your institution, organization, and where you're coming from today in the chat. Well, to get things started, I want to just say thank you for coming to our webinar. It's protecting the mental health of rural community college students, creative innovations in challenging times. My name is Sean Robbins, and I am the Policy Associate at the Association of Community College Trustees, leading our Strengthening Rural Community Colleges initiative at ACCT. I'm excited to be leading this work and partnering with the Rural Community College Alliance, RCCA, to provide support to our rural community colleges. Before we get started, I just want to share a glimpse of where everyone is coming from today for today's webinar. So if we see here, this is our ACCT region representation of who is actually registered, and this represents the actual institutions. So for the Pacific region, we've got 24. Central region is leading with 30 institutions that are represented from the registration for today. So thank you, everybody, for joining us here. Throughout the webinar, feel free to utilize the chat, seeing how it's up and running, and we've got that all set. Make sure that you introduce yourself there as well. And as a note, we are recording today's webinar, and we'll have the recording available up within the next week, and it'll be posted on our website. We'll also send a link out to the recording as well, so you'll have access to that. So today we are joined by Dr. Kurt Michael and Diana Cusimano. Get that? Sorry, from the JED Foundation. Dr. Kurt Michael is the clinical director of JED High School West. He recently retired as the Stanley R. Eichelman Distinguished Professor of Psychology at Appalachian State University. He was trained at the University of Colorado, Boulder, Utah State University, and Duke University Medical Center. His primary areas of research and clinical practice are adolescent suicidology, school mental health, and rural health care. Dr. Michael's empirical work has appeared in numerous scientific journals. In addition to his research interests, he is a practicing licensed psychologist, and in 2006 developed and implemented interdisciplinary school mental health partnerships titled the Assessment, Support, and Counseling ASC Centers in rural Western North Carolina. In 2014, Dr. Michael was honored for his long-term service to North Carolina as the Board of Governors recipient of the James E. Holzhauser Jr. Award for Excellence in Public Service. He joined actually the JED Foundation recently in July of 2022 to help oversee the scaling up of the JED Foundation's comprehensive model in the Western U.S. Primary goal of JED High School West is to provide strategic consulting and technical assistance to school districts across the Rocky Mountain West to promote emotional health to prevent suicide among the nation's youth. And Diana comes from a background in higher education prior to JED, where she worked for 12 years, gaining experience in college counseling, student affairs, and academic services. She has now worked at JED for over 5 years. In her current role, she oversees the JED Campus program, which has 400 schools nationwide. She is a licensed national certified mental health therapist and a registered 500-hour yoga teacher. Diana continually educates herself on most up-to-date mindfulness and leadership practices, and is taking courses most recently with the Mindful Schools Search Inside Yourself Leadership Institute, has her Koru mindfulness teacher certification, and is Dare to Lead trained. Without further ado, I'll hand things over to Dr. Michael and Diana. Thank you so much for joining us.
Great, thanks, Sean. Hey, Sean, can you do me a favor? Can you make me a co-host so I can share my slides?
We'll get you all set.
Thank you.
There you go.
Perfect, thank you so much. Well, welcome everybody. Diana and I are excited to present today. We've got some slides for you, so let me share my screen to make sure everybody can see on my screen. So hopefully you can see those. Can you see those slides?
You're good to go.
Okay. So anyway, it's our pleasure to talk about these issues today, and I can dispense of this part. This is basically our intros. You've already heard from Sean, our backgrounds, so we'll get right to it. So both Diana and I work for the JED Foundation, which Sean just indicated is the mission is to protect the emotional health of young people and to prevent suicide. And so I'm going to turn it over to Diana to begin the presentation.
Thanks, Kurt. Hi, everybody. Like Kurt said, very excited to be here with y'all today about a very important topic. And we thought we would frame the session by giving you a quick overview of JED and also national trends we're seeing regarding adolescent and youth mental health. So to that end, the mission and vision of the JED Foundation is really creating a future of having a safety net for every college, every high school, every community for students, adolescents, and youth that creates a culture of care for them. So really the vision is we really want to make sure that all teens and young adults are equipped to navigate mental health challenges, to seek and give help, and that they're emotionally prepared to enter adulthood. But along those lines, we want to make sure that everybody that is around those young adults has the skills as well, in order to help support them and give them resources. So we have quite a few different programs within the JED Foundation that I'm going to touch on really quickly. And the main program we'll really stay with today is the JED Campus program, in which I oversee. So we can go to the next slide, Kurt. Okay, so I won't stay here too long, but the JED Campus program is a program where schools, colleges, and universities, I should say, sign on with us to do an assessment process for their schools. So that includes looking at how students are feeling on campus with knowledge, behaviors, and attitudes using the Healthy Mind Study, but also looking how administration is supporting those students regarding things such as policies, procedures, social connectedness, all those kinds of things for students on campus. We have two different programs within the JED Campus program. We have a 4-year program, and we have an 18-month shorter program called JED Campus Fundamentals. The flip of that is JED High School, where Kurt is really working in right now, which does the same thing pretty much as JED Campus, where it's really looking at how are administrators supporting their students, but also how are the students feeling within high schools. The hope is, in our dream world, is every JED, there's a JED High School and a JED Campus everywhere, and it's a nice continuation for students where they can go from high school to a JED Campus. But we'll get more into JED Campus in a moment. Some other free resources here I really want to point out that you can utilize, write them down, take a picture of this slide. These are really great for you to plug and play and use within your institutions. CZAwkward.org is a wonderful campaign we did for peer-to-peer help seeking with the Ad Council. It's actually an award-winning campaign, and you can find a lot of great videos on there. You can find a toolkit that you can use in your classrooms, in workshops. Please check it out. As it says at CZAwkward.org. Set to Go lives within the high school program, and it's really giving resources to families, educators, communities about how to support students when they leave high schools and they go into quote unquote adulthood. So that's a great program to check out. Lifeline is a free online screening tool that you can utilize and you can use within your institutions, within your counseling centers. You can sign on to be a Lifeline school, and then you can get reports and whatnot run from Lifeline. Mental Health is Health is a project and campaign that we do with MTV, and it's a wonderful hub of information about all things mental health related, all things mindfulness related, all things wellness related, and there's a lot of great videos there too, great content that students really appreciate, as there's a lot of famous people that are interviewed and a bunch of other cool things on there. So check that out. That's mentalhealthishealth.org. And then Love is Louder is more of kind of like a social media campaign. You can follow Love is Louder on Instagram or TikTok. And that's really about spreading the awareness that there's so much more in this world besides hate. And this is really a campaign to dismantle those feelings, to show that love can kind of conquer all. It was one of the earlier JED programs, but it's a really cool one. So check that one out. We can go to the next slide, Kurt. All right. So let's give a quick overview for y'all, just nationwide, what's going on for our students. And I'm sure you all are more than familiar with what's happening, but it's always good to kind of refresh ourselves about what's going on within the data for our youth and our adolescents out there, or our young adults, really. So this slide is really a great one, I think, to kind of capture all the different things that are happening with mental health. As we know, nationwide and worldwide, we've all been through a lot. We've been through a pandemic. There's a lot of racial injustices happening. There's a lot of horrible world events, national disasters. I mean, really, y'all, we've been through it. So it kind of makes sense psychologically that maybe some students are feeling a little more anxious or a little more depressed. And Kurt will get very deep into this to later on in the session. But a quick overview, and some ones I like to point out that I think are really important to help frame what's going on with suicide prevention and whatnot here with our youth, is really about 1,400 young adults died by suicide, and that's within the year of 2021. That's something to really look at. I think it's a very stark number, and as we know, that kind of increases as we go along here day to day. And then another one I like to point out here is 41% screen positive for depression and 34% screen positive for anxiety. You'll actually see when we talk about healthy minds data a little bit deeper into this session that's actually a little bit higher right now. It's trending a little higher. So this is really important to help frame the why we do this work, why JED exists, and why it's really important that we all are educated in how to help our young adults around us. So you can go to the next slide. Like I mentioned just before, a quick capture of the pandemic effects on mental health. We're seeing now a lot of the effects of what the pandemic has done, but I know that we'll be seeing them for years to come. But some of the things that we have seen, and y'all might have experienced it yourself, you know, I know for me, I've experienced some of these things, is there has been from quarantine to coming out of quarantine to kind of spikes in different kind of variants, you know, there's increased anxiety. There's increased anxiety all around about kind of the ambiguity of what's going on right now within our, you know, our world and our communities. But this has also created social anxiety to spike within our young adults. And that's something that's really important when we do think about connectedness and a campus community and suicide prevention. Increased anger, irritability, increased substance use and misuse. And this has triggered a lot of trauma in people. And there's also collective trauma that we have gone through when it comes to the pandemic and us processing it. I think only now we're kind of starting to process what has gone on for us and how our lives all changed throughout the pandemic. And there's other unique stressors that have occurred for us, right? There's pivoting to remote, going back to in-person, going back to hybrid. I mean, it's a lot of adjusting, a lot of transition that happens during this time. There's been a fear of infection, getting sick. Grief is very big. There's been so much loss around us in lots of different ways, and secondary losses, not just loss by death, but loss of events, loss of, you know, celebrations, those kinds of things I compound. And that's what I mean by us still kind of trying to process this right now. And I think the financial insecurity and food insecurity that's been going on too within our world and our society is also a really big thing that we need to point out that we know affects psychological well-being. So this is, you know, to frame not just from the pandemic, but just what's been going on within our world in the last year or so. You can go to the next slide, Kurt. So another kind of slide on the pandemic, just to give you some more context. We pointed out this data point before about the 41% screen positive for depression, 34% for anxiety. But what's interesting, another thing to point out is there was a decline in students receiving services in 2020, but what's really hopeful here is numbers have started to rebound. So students are out seeking help again now, and I think that's a really big thing to point out, that this is the time right now to really increase any kind of barriers, decrease any kind of barriers to help seeking, and really help students know what resources are there and that there's help for them in your communities. Another one to point out here, is I know y'all are reading it, is that the 5.8 out of every 10 students experience the basic needs insecurity. That's just what I was saying before. It's a really big problem, and it's one that we have to think about in context. If students' basic needs aren't met, you know that's going to affect them negatively psychologically. We can keep going to the next slide. And this is interesting. So this is a study of among community college students that was done, that I think it's pretty cool to kind of see what went on in this study. So this was done by the Mental Health Coalition amongst community college students that you can see right there. And you can see that community college students, I'm jumping to the third bullet, particularly those from traditionally marginalized backgrounds, were significantly less likely to have used services compared to four-year campuses. So we know that our community college students need some different things than a traditional four-year residential college student. And we also know that a lot of our community colleges maybe don't always have as much funding, grants, money to maybe offer some of these resources. But we also know our community college students tend to come in, come out, and they're working full-time jobs or managing families. There's a lot going on. So it does make sense that, less services were used, but I think it's really important to look at the traditionally marginalized backgrounds, as we know that our students of color and students that come from different types of marginalized backgrounds do have a harder time getting services that they need. And that's really important to keep in mind as we talk about things today. You can go to the next slide, Kurt. All right, so let's touch on again quickly, what is the JED comprehensive approach and what is JED campus? So this was created by actually two parents lost their son Jed, our founder, to suicide when he was a freshman in college. And this comprehensive approach came from that jumping off point of them wanting to really create, like I said earlier, a safety net under every high school, every campus, every community within the nation as best they can. So they took this one from the United States Air Force suicide prevention program, and they met with experts, and they came out with our nice wheel, as we call it. And within this wheel are different protective factors and different wedges of what really we want schools to focus on in order to have a culture of care for their students. Each wedge you can go into for a very long time about all the things in there, so I won't do that right now. But I will point out that it's really important to kind of just take a look that you will see strategic planning goes all around all the wedges. So this is something to think about as you're planning your institutional strategic plans or planning things for the next academic year, is that you want to take into account the different areas on this wheel, and you want to take into account that there needs to be an institutional wide strategic plan that has wedges about emotional well-being for your students. The bigger thing that's to look at is equitable implementation. As I mentioned briefly before, this is actually a newer addition to our comprehensive approach, but we want to make sure any program, anything that we implement on campus has the lens of equity in it. And that's something, again, to keep in mind as we chat today. And you want to make sure that you know for your campus the specific demographics of students that you might have to think about that maybe aren't always involved or even heard in policies, procedures, campaigns, programs, and those kinds of things. So you can keep going. So this is kind of just giving you another bit of what each wedge does. If you see the different comments here across the page about the wheel, the one we're going to really focus on today that Kurt will talk about is promoting mean safety. We're going to do a nice deep dive into that one. But if you want more information on any of these areas or whatnot, please reach out to me. And we could talk to me or Kurt, and we could talk to you about them. And as I mentioned before, JED has really dive deep into equitable implementation. We have a few frameworks. Y'all, these are all free. Please go onto our website, download them, look them up. You can use all of these. We have a students of color framework that we did, the equity mental framework we did with the Steve Fund. We have one for students who are parents, one for our graduate professional students, and LGBTQ plus students, our Proud and Thriving framework. These are wonderful. We partnered with so many experts in the field for each of these. Please download them and run with them. So, and keep this in mind as we're chatting today about the equity piece. It's really important. Go ahead, Kurt.
All right. So I'm going to talk for a few minutes and just want to say thanks to Diana for that really thorough review of kind of what's known and not known at this point. So thank you, Diana, for an excellent presentation. So I'll just want to echo something she said earlier. One is that since the pandemic, we've seen, in some cases, doubling of yearly rates of depression and anxiety and suicidal thinking. It's pretty unprecedented. So I just want to reinforce some of her earlier messages there. But let's take a more focused look on the problem of suicide in rural settings and how that's relevant to rural community colleges in particular. So let me get into that a little bit. So if you look at the epidemiology of suicide in general, I think it's pretty striking that a person dies by suicide in the US every 11 minutes. This is not an uncommon occurrence. If that translates to a young person, that's about every 90 minutes a person who's younger dies by suicide. If you look at the total number estimated in 2019, there are over 47,000 suicide deaths in the US. I think there's 800,000 worldwide. So there are definitely other countries that have higher suicide rates, but certainly ours is nothing to be happy about. In terms of the breakdown of that younger age group, which is kind of the target population for today's talk, between 15 and 24, that's around 6,000 young people that died by suicide in the previous year accounted for here. That's a lot of loss of life. The other thing that's true is that we need to be equally concerned about people who make attempts. And so I think a lot of times there's estimates, and we're not exactly sure about the numbers, but we estimate that across all ages, there's 1.4 million attempts across that range. And if you look at younger groups in, say, high school, about 2.5% of US teenagers self-report making a suicide attempt that was treated by a medical professional during the previous year. So again, hopefully this gives you a snapshot of just how serious this problem is, and it's particularly problematic in rural settings. To sort of look at different demographics and trends by race, we look at pretty across the board increases over the last, say, 10 to 15 years among Black males and females, Hispanic males and females, and white males and females. Pretty consistent surges in all of these areas. Now, granted, the overall base rates for females tend to be lower than males. You start to see some pretty incredible increases just over the past 10 years even. So just to really highlight this, and probably not something that you're unfamiliar with, youth, if you look at trends by sexual and gender status, these are some troubling trends in terms of suicide attempts and also having suicidal thoughts as well. So you can see the rates there. So a significant factor in determining those who might be at enhanced risk for a suicide attempt or having suicide death include LGBTQ plus youth, transgender youth, and non-binary and gender questioning youth, all pretty consistently double or higher the average compared to the overall rates. So something to definitely keep in mind. And then let's talk specifically about the rural suicide problem. So we know that this is a pretty consistent finding over the past 2 decades, that if you happen to live in a rural region, your risk of suicide death is twice than if you lived in a non-rural region. This is something that's been reported multiple times in multiple studies. It's particularly problematic in the Rocky Mountain West, which most people are aware of, but what people are less aware of is that these trends of rurality hold true in even places that are not, let's say, entirely rural regions. North Carolina, for example, the suicide rate in North Carolina is about, the crude rate is between 10 and 12 per 100,000. That's a national average. But if you live in a rural place in, let's say, rural Western North Carolina, which is where I spent the last 24 years of my life, it actually rivals the Rocky Mountain West. So double the state rate if you live in a rural part of North Carolina, both towards the coast and also in the mountains, the Appalachian Mountains. So we find those trends pretty consistent across the country, whether you're in the Rocky Mountain West, the East, the central part, the South, et cetera. We see similar trends. And if we look at the data for youth in particular, also very troubling. The idea that if we parse out the data for the most rural teenagers, it still holds true, double the suicide rate. Now, granted, it's less common overall, but still, anytime you see a doubling of something, I think we should all take notice. So hopefully that really does spell out the concern there for you. We often wonder why. Why is it true that these rural populations tend to be more at risk for suicide? And these are just a few known factors that I'll discuss with you right now. One, maybe a more kind of obvious one is, and I think even Diana mentioned just a minute ago, in terms of availability of folks who can provide services. even since the pandemic, there's been sort of on the plus side, there's been the advent or more innovations around telehealth, which is good. But then we also have ongoing issues like bandwidth that continue to be problematic. So even if you have more providers that are able to do telehealth, you don't necessarily have the infrastructure, the hardware, the software to make that happen in some of these more remote regions that remain problematic. So even if you can get more access through telehealth, that doesn't always solve the problem. Access barriers also include things like if you have to choose between using gas money to get to work versus get to the clinic, typically what's going to win out is getting gas to go to your job. Remoteness is a big problem. And if we live far away, even our willingness to travel that distance can be a serious problem. And remoteness is not just a question of transportation. It's often just maybe a magnified feeling of isolation in a remote place. You're all familiar with affordability limitations. Folks that we see often don't have adequate insurance, or if they have insurance at all. And last but not least on that list of known barriers is the issue of acceptability. That is, oftentimes the perception in rural places is that help seeking is not sort of commonly seen as a viable option, maybe even a sign of weakness. Lots of concerns about privacy, that if you are in a small community and people could see your car at a clinic, concerned about what that might mean for privacy and so on. Other factors we know that are true in rural settings are ready access to lethal means. Firearms is one that comes to immediate to mind, and also opiates. Access in rural regions to opiates certainly doesn't help matters at all. We know that the overdose deaths in certain particular rural areas is significantly high, that needs to be taken into account. So really what I'd like to do is return to what Diana presented earlier, the idea of the JED wheel, if you will. And so the wedge on that left-hand side of the circle is promote mean safety. So let me kind of take a little bit deeper dive into that, as that relates very much to rural community colleges, in my opinion, and all of the work that I've been doing over the years. And so let's talk about mean safety. So why do means matter, you might wonder. Let me give you 4 reasons. Number one, we know that suicidal crises, when they do happen, thankfully, they're often quite brief. So really the goal for such a situation is to survive that brief crisis. Now, I'm not saying that every suicidal crisis is always super brief, but often it is. And so what we're trying to do is preserve life. And so even to have the opportunity for treatment, we need folks who make attempts, we need them to survive so we can offer that life-saving care subsequent to an attempt as the first reason why means matter. Another reason is that some methods, and I already mentioned them, firearms, are far more lethal than others. And I'll get into this in a second. But in terms of the mechanism of suicide death for the US, it's consistently firearms as the leading mechanism of suicide death. There's really not even a close second at this point. There's some subtle distinctions in terms of prevalence rates of mechanism, but I'll get into that in a minute. But bottom line is we want to focus on the most lethal method, and we want to focus on the most common method, which I think I'll talk about in some detail in a minute, is pills or taking an overdose. So we'll talk about that in a minute too. Here's the good news. The good news is if we can promote survival, greater than 90% of those people who make serious attempts, they actually do not go on to die by suicide. Sometimes the assumption is if we make an attempt, that's basically a guarantee or that death is inevitable. The data don't bear that out. So I just want to really reiterate the fact that, saving a life in the short run usually means a life saved in the long run. So something to really take to heart. And then last but not least, another reason why means matter is that a lot of folks, even when they make very lethal attempts, will often report back when they survive to caregivers, providers, professionals, that to the very last second that they made that very lethal attempt, they're quite ambivalent about that choice. That a lot of folks, that sometimes the thing is, if you've made up your mind, you've made up your mind for certain. And that means that even if you do not die by suicide with that attempt, that you'll just come back and keep doing it. Again, the data don't seem to bear that out. The bottom line is, we view this information as opportunities for intervention. We want to prevent death, obviously. We want to promote treatment, but to do that, we have to have people survive these crises. So the essence of mean safety is really in this box, putting time and distance between that suicidal person and a highly lethal means can be the very factor that saves that life. If you talk to folks who have survived near lethal jumps from the Golden Gate Bridge, for example, they almost uniformly report that they were very ambivalent up to the very last minute, last second even. And what is really remarkable is there are a couple of folks who have written their own biographies about these experiences. They say that everything that felt unchangeable before they made the jump seemed to be instantly solvable, except for what they just did, which is jump off the rail. And the minute their hands leave the rail or the jumping point, that's when they really regret what they just did. And we know that because they tell us that, right? So anyway, that's why I think this is a really sensible way to focus efforts. It's really about environmental safety, quite frankly. So let me give you an example that's international. A lot of our studies on promoting mean safety come from the international community. Here's one. So in the Israeli Defense Force back in the early 2000s, they had a very specific problem with suicide death among their soldiers. And you might be aware that in Israel, military participation is not entirely compulsory, but about 60% of youth from Israel serve several years in the military right when they sort of turn 18, basically. And so these are functionally college age and young people serving in the military, and they get issued a sidearm. And so what they decided to do, which is very clever, they decided to basically have the youth, the young adults, check in their firearm on base before they went home on leave every weekend. They don't stay on base over the weekends typically, so they usually go home or go to communal living over the weekends. And so what happened is that this requirement, this policy shift, actually resulted in a decrease of suicides by 40%. I don't know about you, but anytime you see any kind of a change that's 40% of anything, that's something to stand up and shout about. So here I am shouting. That's good news. Here's the bad news. The bad news is the suicide rate only dropped on the weekends. And remember, the policy was check your sidearm in on the weekends. There was no change on the weekdays because they still had their sidearm with them. So access to that lethal sidearm, which again, in the military, kind of serves that dual purpose of being protective, but it also poses a danger to those people who might be acutely suicidal. So again, why? Why do we think this has been true? Well, in fact, in terms of overall attempt rates, they didn't necessarily change. So the behavior of attempting didn't change, the death rate changed. We have similar examples in Sri Lanka, in other parts of the world that show that these kinds of policy shifts to reduce access to, say, pesticides that are lethal and banning them actually result in one particular study in Sri Lanka over a 10-year period, resulted in 20,000 lives not lost to suicide as a result of this policy shift or this policy action. So anyway, here, get back to this whole point. This is kind of the truth about the United States. This is everybody over the last 20 years. Again, by far, the leading mechanism is firearm, followed by suffocation and poisoning. So again, not to say that you wouldn't put prevention efforts on all of these mechanisms, but you certainly want to maybe put your top priority on firearms, certainly. And then, of course, the 17% poisoning, that would be the, taking pills, for example. So it's not to say that you're out of the woods when if you just focused on firearms. And dealing with suffocation or strangulation mechanisms, that's a lot more challenging, by the way. And we can talk about that maybe in the Q&A part, but I just want to point these data out as ways that we'd like to inform prevention efforts in communities, especially rural communities and rural community colleges. So let me just give you an overview of what that specific tangible action item looks like. So there's a particular kind of means safety program called CALM, stands for Counseling on Access to Lethal Means. It's been around for a while. It's not necessarily anything super complicated. It's basically, if you're on a college campus and you have a mechanism to assess suicide risk, you would just do your normal thing. So whatever you do to assess suicide risk, you keep doing it. But what you would do, this is the added feature of CALM, you would basically be much more deliberate in your explanation to students and families that suicidal feelings come and go, kind of back to the 4 main reasons why means matter. You would reduce access to lethal means, especially firearms. And again, if you think about decedents who die by suicide, where they typically take their lives, it's usually in the home setting. Well, in a rural community college setting, most of the students aren't going to be necessarily living on campus, but maybe living in apartments or somewhere in the community. So again, necessarily having some control over like a dorm unit would be less relevant for community college population, certainly. And in fact, there's plenty of access to firearms in home settings in rural communities. So again, trying to explain this safety feature to students and other folks that work on community college campuses would be a good idea. Another added piece that we would recommend is to collaborate on that plan. So trying to reduce access to firearms and medications, again, leading suicide method, leading method of attempt, as well as whatever the ideation of that student focuses on as a result of that particular crisis. Again, CALM is very specific. Everybody kind of agrees, okay, if you think it would be helpful for a roommate who lives in an apartment with a student to help kind of dispense of any kind of expired medications, or to get a lockbox and help support that peer in coming up with a safe way to store their meds, would be a good idea. The gun thing is a little bit more challenging, and I can talk about some of those techniques maybe at some other point if you want to follow up with me, and I can talk to you about that. You definitely, certainly want to be cautious about the way you approach that in a college setting, but I can talk about that as well. And then certainly what we'd recommend, which is good sort of standard of practice in managing suicide risk, is to make sure there's adequate follow-up. So if you interact with a student who has suicide risk, whatever your mechanism for assessment happens, just making sure if that's the case, you also include a follow-up piece to your work with these students, if in fact that's part of your infrastructure in your community college setting. And again, just to kind of remind you, basically what CALM is public health. It focuses on the how of suicide. It's sort of less concerned about the why. The why is important, but the how is even more important. Prevention is basically through safety planning, which is a bona fide specific way to reduce suicide risk. And really what it does is acknowledges the fact that we really don't have a good way to predict who's going to attempt. That's kind of scary and true at the same time. I would like to say to you that we have a better way to predict those who might attempt. Truth is, we don't. We can't predict all these things that might happen in someone's life. That's why we focus on environmental safety, right? That's kind of the lowest hanging fruit that can be addressed sort of informationally and broadly, and doesn't require you to even know a bunch of protected health information about your students. You just educate the student or the campus community on the value of this approach, and you can actually get impact based on these broad community-based efforts to educate folks on this environmental safety approach. Again, specifically about medications, and I'll try to stop and see if there's some questions and comments. As I mentioned, the most common method of attempt is medications. Thankfully, overdose is often not fatal, but Some combinations are more dangerous than others, like opiates and benzos and alcohol combined with other prescription meds. It's super easy to find lethal combinations on the internet. We've had kids come and say, yeah, I realized that if I take X number of these, then I'm likely to die. So I took 2 more than that. I mean, you hear that all the time where kids are actually being able to find this information online, which is not awesome. But anyway, it's pretty straightforward for them. Reducing access, again, we often work with prescribers, or we work to reduce dosing in the home using lower toxicity medications when possible, maybe limit quantities. We work with students that have had, have their insulin that's life-saving, but it's also by the same token, dangerous, because if they took an overdose of their prescribed medication, they can also succumb to that. So we want to try to get creative. We've involved, the campus health service or even nurses to help, manage dosing if that's feasible. Taking these drug interactions into account is an important thing, and we often call poison control hotlines because they know a lot more than we do about certain interactions that are dangerous. So we often consult with those folks. But these are the steps that we would advise. We would certainly suggest recommending disposing of unneeded expired meds. We would try to reduce amounts of non-lethal quantities. Even over-the-counter pain reliever would be a super helpful step. We would recommend that people lock up abuse-prone and dangerous drugs. These are some examples. We often ask health departments, we write grants to get a supply of lock boxes that we can hand directly to students right there in our offices. And so usually behind my desk, most days I'll have literally a stack of lock boxes that we dispense. And then again, trying to get in communication with pharmacists can be a super helpful step for local colleges and community colleges for sure. So anyway, that's kind of the last main recommendation about mean safety I want to share, but I also wanted to say this kind of gives you a sense for JIT Campus Reach. I think Diana could certainly respond to some of the questions better than me, but happy to entertain questions, comments right now.
Thank you so much, Dr. Michael and Diana, for all this insight and information. I really do appreciate it, and I know everyone in attendance too really appreciates all this insight. Feel free, folks, if you have any questions, you can put them into the chat. We'll get those answered as well. We have one question that has come in. Is asking about wondering what suicide assessment you find most helpful or prefer for college students.
And do you want me to take that one, Dan? Sure. Okay. So there's a few out there. I mean, you're probably familiar with the Columbia. That's certainly a good one. There's the ASQ, which is also quite good. I can get the definition of the ASQ. Pardon me if I can't remember the exact reference to that, but those are the two that would jump out. And then a third maybe to suggest would be, this is a little bit heavier lift for college campuses, is to try to help increase capacity in a campus's ability to administer what's called CAMS. CAMS stands for Collaborative Assessment and Management of Suicidality. It's a particular program that's evidence-based, that's been studied in RCTs or randomized controlled trials and found to be effective. So those are the three that I would mention.
Thank you. I think with all this information and resources that you provided, what would you say would be, or what would you recommend as like some initial next steps for community colleges, rural community colleges specifically, that they should take or start putting into the forefront?
I think a lot probably depends on what's currently available on that campus. In terms of workforce, like are there folks on hand already that might have an investment in this? I think I would definitely want to start there. Oftentimes starting from scratch is tough, but if you've already got existing expertise on your campuses, I would start there. And if you can identify those local champions, to me, that would be a place to start sustainability usually hinges on whether you can identify that particular local champion and they can help lead those efforts locally. Certainly there's options to involve technical assistance, JED would be an example, but before that, I would say identify that person that's likely to be, spearheading such efforts would be probably a really good place to start.
Any other questions that we might have from folks? Oh, we got one just as I said that. Great. How important is it to have on-campus mental health support or experts?
Do you want to take that one, Dan?
From the JED POV point of view, we would recommend that every school has that, but we also understand that's not always possible. So I think it's not maybe necessarily having someone on campus. It's maybe making sure you have people, at least in your referral networks in your community, that you can count on. They don't necessarily have to be on campus, though that is the ideal. But if you know that community, that org, that person that you can always refer your students to, that's very important. And JED would also say having an MOU, a memorandum of understanding, like some kind of contract in case you left and had that relationship with that person, that it's just standing with the school, would be super helpful as well. Also utilizing as much as you can, as we know, though sometimes Wi-Fi is not great in rural communities, but utilizing telecounseling, telepsychiatry is another avenue that's been really helpful that we've seen recently.
Yeah, I think this has been wonderful. All this insight from both of y'all. This is a webinar that I've been really looking forward to, to getting more insights, getting more information, and hearing about more of these resources. Speaking of which, we have one more question for y'all. Feel free, folks, if you have more questions, put them into the chat or the Q&A. We'll get those answered for you. The question here is, are there particular trainings for faculty and staff in reaching out to students that are well received?
Do you want to take that one, Dana?
Yeah, I think someone just listed QPR in there, mental health first aid, right? There's also a JED training that you can check out. It's called You Can Help a Student or You Can Help a Friend, that you can check out on our website as one. But I think the ones you listed are the ones we tend to hear the most: QPR, Campus Connect, mental health first aid, like Kurt said, CALM training. I think sometimes what works best is having targeted, smaller, shorter trainings with champions of that area presenting the training to that area, meaning like faculty having someone from that department helping to present these trainings to their other faculty members. But Kurt, do you have others that you would recommend?
No, I think you covered all the ones that I would have said. So yeah, thank you.
Wonderful.
I saw something. I'm sorry, Sean. I saw something in the chat there.
Yeah, there's seems another issue with telehealth is that many students don't have a private space to engage in therapy. Are there any recommendations that you might have? I know it can be a little walking on a tightrope, so to speak, with trying to find that private space, but what would you recommend?
So that's a really important point. I guess what we've run into is that sometimes implementation of telehealth, if you don't have protected space for students, whether it's an outside provider that sort of remotes into the school, and you have somebody kind of coordinate it on their side of things, that it's at the school. So we've actually asked for devoted time for people to volunteer to be the site kind of facilitator of telehealth on a campus. That seems to be helpful, even though space is often pretty tight, obviously. Trying to build a area, there's a mentioning of student in the library. We've done that too. So I think those are good suggestions. If there's protected space that can be reserved for this very purpose, we think that's a good use of resources.
Wonderful. Other questions are coming in, which is terrific. Have you found any college, or specifically maybe a rural community college, that is doing a really good job on addressing just the overall stigma of mental health?
Through the JED Campus program nationwide, we're seeing quite a few schools being able to handle that well. And I think what sometimes it comes down to, like Kurt mentioned before, is having those champions on campus that really help to drive home the need and the passion, and then having a framework to use to help give you ideas and help you not reinvent the wheel with ideas of how to break down stigma and shame. It's a heavy lift, as we know, but it can be done. But really having those passionate, motivated, I think, individuals on your campus will really help to, even just shifting a little bit can help to change some lives for some students. You don't have to necessarily fix the whole campus, but trying to fix pieces of it for your campus community could be really helpful. But in our JED Campus program, yeah, we have quite a few doing pretty great work with that.
That's great to hear. I think we've got a few more questions. I think we can be able to get to all of these here before we wrap up today. I think Dr. Michael, this would be more towards you. And in the suicide attempts made, did anyone close to a person suspect that they were suicidal?
Well, that's a great question. I think what we know to be true is that about 80% of folks who make an attempt or die by suicide usually give some type of signal that either in retrospect or in real time has been expressed and known. So again, there's certainly a small percentage of folks that never really signal or give a warning, so to speak. But I think for the most part, being educated about some of those warning signs can be a helpful way to maybe make better use of whatever information is coming in. I think that the other thing you want to be careful about is a lot of folks feel sort of a sense of guilt that they didn't see something, they didn't recognize something, and we don't want to reinforce that notion that there's something that a loved one did wrong. It's more like, this is a pretty scary thing, and we know that from people who have told us this, that even for people who are considering an attempt and make an attempt, it's terrifying for them too. So I think a lot of times if something's not known or seen, it's not due to anybody's fault. It's just the way this process sometimes unfolds. It just does. And I think some of it is just sort of the perceived need to be secretive about it, just because it feels oftentimes kind of shameful. And we want to try to change that sort of discussion, that if you're having these kinds of experiences, that we want to provide information to not only support survivors of suicide loss, to not reinforce any kind of guilt messaging that they might experience, but rather we can prevent the next one from happening kind of approach, if that makes sense.
Thank you. I've got two last questions here, and before we close out. Are there any suggestions on how to overcome cultural barriers in seeking help or reaching out for help?
Want to take that one, Dana?
Yeah, that's a great question. I think we all have a lot of learning to do around this area. So the more you can kind of educate yourself around this topic is really helpful. But you could, I did point out the equity and mental health framework before, and I think that's a great one to even start with regarding students of color, to get ideas about how to reduce barriers to help seeking. There's literally different, 10 different points for you to follow as a campus to look at, and that can actually spur off some ideas for you. That's the first thing that came to my mind as a quick way to help you. But I think kind of just educating yourself around the demographics of students that's in your community, and maybe those that maybe don't see themselves within your community, is really helpful. There's so much out there now that you can utilize. But Kurt, I don't know if you have anything else to add to that one.
No, that's perfect. Thank you.
Wonderful. And I think the last question here are there any examples of maybe any successful grant-funded projects that either supplement or support an existing counseling campus program?
Well, that's probably a long, complicated answer.
Yeah.
I guess the short answer is yeah. There's lots of funding streams out there that can be sought after, and Department of Education has several. Institute of Education Sciences, to name at least two. Diana, do you have any? There's a lot of foundations offer funding. I would recommend certainly a foundation search. Any other things to add, Diana?
Yeah, the SAMHSA grant is a big one a lot of our schools utilize, but I think looking in your state and seeing if there are mental health funders, that's actually where a lot of our schools come from, is someone who's funding this work. And right now it's you know, it's really at a tipping point if everyone's talking about it. So even just doing a quick Google search, you might come up with something. You never know. So
Oh, well, thank you so much, Dr. Michael, Diana. This has been very informative, and I really appreciate you being able to take the time and share all this insight and your expertise with us. It's these resources are wonderful, and everybody, we will be sharing out this recording as well as resources that Dr. Michael and Diana have been talking about. So again, thank you so much, everyone, for joining us today. In looking forward, I just want to put a plug in. We're going to be continuing the conversation here on mental health during our peer learning network discussion. So here are some of the links. Please feel free to sign up. This is going to be an opportunity to continue the conversation and also collaborate with other rural community colleges and share how your institution is supporting your students, faculty, and staff. Really being able to collaborate together and share those insights. So be sure to register via the link right there. And then looking forward to next month, we're going to be talking about cultivating digital equity, and we'll be joined by the Office of Ed Tech at the U.S. Department of Education. So be sure to sign up for that as well. Again, thank you everybody so much for joining us here today. We're really grateful that you joined. Dr. Michael, Diana, thank you again. We really appreciate you. And until next time, y'all take care.
thank you.
Thank you.